This week, we are going to be talking about evaluating the credibility of health information, particularly the information that we find online. There are so many sources of health information online these days that it can be difficult to determine what is credible and what is not a credible source of information. So we're going to cover credible sources of information in this lecture. We're going to talk about some ways to identify whether a source is a credible source of information and hopefully provide you with the tools that you need to evaluate the credibility of the information that you find in today's online world. So who would you trust more for health information? Would you trust the Centers for Disease Control and Prevention or Wikipedia, a free online resource? Hopefully you said the CDC. The CDC is a governmental site that is reviewed by experts and scientists, while Wikipedia is actually an open source site, meaning that it can be changed by pretty much anyone who wants to do so. So the CDC is going to have been reviewed by experts in the field, while anyone can really go onto Wikipedia and make changes and add information to that site. So who would you trust more for health information? Harvard Health Publishing at the Harvard Medical School or WebMD? Well, one is an educational site, Harvard Health Publishing at Harvard Medical School. This is an educational site that publishes material for health-related purposes, while WebMD is actually a for-profit organization whose goal is to make money, not necessarily has the same values as an educational site like Harvard Medical School. So there's a lot of different sources of information when it comes to news outlets. And so who would you trust more for health information? Would you trust CNN, Fox News, the BBC, NPR, MSNBC? In truth, the answer is I wouldn't trust any of these sites to really gain health information. News stories can often prevent bias in different ways or simplify study findings in a way that misrepresents what those findings actually were. I'm not saying don't listen to them, but what I am saying is to always make sure that you can back up their sources. If they cite a study, go to that actual study and review it for yourself. Determine, is that study's findings aligned with what is written in that article? Or, is the article written in a way where it's been designed to get people to engage with that news article? Has it sensationalized the findings above and beyond what that study found? So these news organizations are often putting out information and stories. And as of 2016, few Americans express high levels of trust in the news that they get from professional news organizations or from their social connections. Just 1/5 of adults say that they trust information they get from national news organizations a lot, and slightly more that say that they trust news from local news organizations, while slightly fewer place a lot of trust, only 15%, in the information that they get from friends and family. Lower than all three is social media. So even as we know, that we as Americans rely heavily on social media for our news, which is often at least partly filled by posts from friends and family, we continue to have very low trust in information from social networking sites. So just 5% of web using US adults have a lot of trust in the information that they get there, which is nearly identical to the 4% who said so in 2016. So when we're looking at health information, especially information online, there are some key questions that we should ask. So first, who is the person giving us that information? Are they a doctor? Are they someone with specialized education or training in this area? What are their credentials? Do they have a hidden agenda? Do they have another reason for giving you this information? For example, are they trying to sell a product or promote a program, maybe for financial gain? In general, Credible sources of health information are typically going to include medical professionals, government websites, so things ending in .gov. The CDC.gov is a government website that is considered a credible source of information. A college or a university website, so something that's ending in .edu. Nonprofit organizations, so .org. We have to be somewhat cautious of these because there are, anyone can kind of set up a nonprofit, but .org can sometimes be a credible source of health information. And peer-reviewed journals are a huge credible source of health information that we can rely on. So in the last slide, we talked about, some key questions to ask, specifically around who is giving us information and their credentials, right? And so we talked about that in general, medical professionals are typically reliable sources of information. So let's take a look at someone who appears to be a credible source, a reliable source of information. So Dr. Mehmet Oz, which most people have heard of, appears to be, a credible source of information. He is a physician. He is trained. He holds degrees from Harvard University and as well as the University of Pennsylvania. He's authored numerous research publications, and he's currently a professor and vice chair of surgery at Columbia University College of Physicians and Surgeons. So by all accounts, he is both an exceptionally bright and charismatic man with a well-established record of being a healthcare provider and a physician. So think about whether this is someone that you would trust, and think about some of the reasons why you might trust or not trust that person. You're going to watch a brief video below, and then I want you to reflect on whether this video changed your mind based on your conclusion regarding this person being a reliable source of information.